If you could see a medical scan of your future self, you probably wouldn't recognize the damage. Not because it happens suddenly, but because it starts quietly, decades earlier, while you still feel young, functional, and healthy. Most people think their health problems begin in their 40s or 50s, but in reality, many of the conditions that ruin quality of life later are already forming in their 20s. No pain, no diagnosis, no warning. The body simply adapts, compensates, and hides the damage until one day it can't anymore. In this video, you're going to learn which health problems usually start early, why you don't notice them, and how they slowly build up until they finally explode later in life. This is not fear. This is how the human body actually works. And this is exactly what we break down here on Hack the Health. Most serious health problems do not suddenly appear in your 40s. What actually happens is that many of them begin quietly in your 20s, without pain, without symptoms, and without any clear warning signs. During this time, the body is strong enough to compensate, adapt, and hide the damage. You feel functional, so you assume everything is fine. But compensation is not healing, and over time, the cost of that compensation accumulates. One of the clearest examples of this process is insulin resistance. In your 20s, your body can handle frequent blood sugar spikes without obvious consequences. You may feel tired after meals or notice slight weight gain, but these changes are often blamed on stress, work schedules, or lifestyle. Internally, however, your cells are slowly becoming less responsive to insulin. To keep blood sugar levels normal, your pancreas produces more insulin to force glucose into the cells. This works for years, sometimes decades, which is why routine blood tests often appear normal. By the time you reach your 40s, the pancreas can no longer keep up with the demand. Blood sugar begins to stay elevated, and what once looked like minor fatigue or weight gain becomes diagnosed as type 2 diabetes, fatty liver disease, or metabolic syndrome. The condition did not suddenly appear. It was built slowly over many years. The same pattern occurs with posture and joint health. In your 20s, slouching, long hours of sitting, and poor movement habits rarely feel dangerous. Neck stiffness or back pain usually disappears after rest, and joints recover quickly from strain. But structurally, uneven pressure is being placed on spinal discs, muscles are shortening on one side while weakening on the other, and joints are wearing down in unnatural patterns. The nervous system adapts to this misalignment and slowly stops reporting danger signals. By your 40s, the accumulated structural damage becomes difficult to ignore. Herniated discs, chronic lower back pain, neck problems, and joint degeneration begin to interfere with daily life. Pain shows up not because the damage just happened, but because the body has finally reached the limit of its ability to compensate. Chronic stress follows the same long-term trajectory. In your 20s, stress often feels productive. It improves focus, pushes performance, and is socially normalized as ambition. Sleep loss is masked by adrenaline and caffeine, and recovery feels optional. Beneath the surface, however, stress hormones like cortisol remain elevated for long periods of time. The nervous system stays locked in a state of alert, and the body's repair systems are suppressed. Digestion, immune regulation, and hormonal balance slowly deteriorate. By your 40s, the same stress that once felt manageable begins to show up as anxiety disorders, burnout, sleep problems, and high blood pressure. Stress does not damage the body emotionally first, it damages it biologically. Sleep deprivation is another problem that usually starts early and becomes serious later. In your 20s, sleeping 5 or 6 hours a night feels survivable. The brain compensates using stress hormones, and performance seems acceptable. Internally, however, the brain's waste removal system becomes less efficient, insulin sensitivity decreases, and hormone regulation becomes less stable. Poor sleep affects appetite, inflammation, memory, and cardiovascular health. By your 40s, years of sleep debt show up as persistent brain fog, mood instability, metabolic problems, and higher risk of neurodegenerative disease. Sleep debt does not disappear on weekends. It accumulates quietly. Muscle loss also begins much earlier than most people realize. In your 20s, if muscle is not regularly used, the body slowly starts to reduce it. This is difficult to notice because strength still feels adequate and metabolism still feels fast. But muscle plays a critical role in blood sugar control, joint stability, and overall metabolic health. As muscle mass decreases, insulin sensitivity worsens and metabolic rate slows. By your 40s, this contributes to easier fat gain, higher injury risk, weaker joints, and lower physical resilience. Muscle is not just for appearance. It is one of the body's main protective systems against aging. Diet-related inflammation follows the same slow pattern. In your 20s, eating highly processed food rarely causes immediate pain. Blood tests often look acceptable, and inflammation remains invisible. Over time, however, the gut barrier weakens, the immune system stays mildly activated, and blood vessels remain under constant inflammatory stress. This slowly damages the cardiovascular system and joints. By your 40s, this shows up as chronic joint pain, heart disease, slower recovery, and higher risk of autoimmune problems. Inflammation is silent for years before it becomes obvious. Another major factor is the lack of preventive care. In your 20s, many people assume they are too young to worry about long-term health tracking. Minor symptoms are ignored and no baseline data is collected. By the time problems are discovered in the 40s, they are often more advanced and harder to reverse. Early data allows early control. Late data forces reactive treatment. What all of this shows is something most people never realize. Your 40s do not suddenly betray you. They reveal what your 20s quietly built. The body keeps track of stress, sleep, movement, and nutrition, whether you are paying attention or not. Health is not lost all at once. It is borrowed early and paid back later with interest. The good news is that this works in both directions. The same way damage compounds, protection compounds too. Small, boring, consistent habits change the entire trajectory of how your body ages. And this is the real purpose of understanding health. Not fear, not obsession, not perfection, but control. If this video helped you see your body differently, make sure you subscribe to Hack the Health, because on this channel, we don't talk about motivation, trends, or hype. We break down how the human body actually works, how problems really start, and how to fix them before they become permanent. Your future body is being built right now, whether you are thinking about it or not. The only real question is whether you are building it on purpose.